My name is Jennifer, and I live in the Chicago area. I'm married, and I have one 5-year-old little girl. I am a nurse, and I actually work in an ENT practice. I love riding horses. I've actually ridden since I was 5 years old, so I'm at the barn several days a week. I also love to walk my dog. I love taking my daughter to the parks. Mainly any activity outdoors, I just absolutely love. So my runny nose with my riding horses has always been an issue, especially when I'm competing at the horse shows. It's really hard. I'm getting ready to go in the ring and I'm worried about my nose, if it's gonna run, and trying to wipe my nose one last time before I go in the arena. I do feel like it has affected my riding and my competition. So my chronic runny nose has been an issue for several years in my life. And since I love being outside so much and being active, it's always just been a constant issue for me where I'm always trying to keep Kleenex in my pocket, or if I'm at the barn or at the park, trying to find where the nearest Kleenex box is. So it's always been a major issue for me. I feel like I've had a runny nose and these symptoms basically since like my mid-20s, and I'm in my mid-40s now. In my mid-20s, it wasn't quite as bad. And then in my 30s got a little bit worse, and then my 40s is really when I feel like it was really disruptive to my everyday life. My runny nose has definitely affected my everyday life, from just getting up in the morning, trying to get my coffee and trying to get my daughter up, and then my nose is running. So it's from the morning all the way through when I'm eating any meals. And then of course, like getting my daughter to bed at night, which is always feels like it takes much longer than the normal bedtime routine. But it's always been an issue for me. And my daughter is even like, "Mommy, why do you always have to have Kleenex in your hand?" There were several treatments that I had tried previously for my runny nose, such as antihistamine tablets, as well as nasal sprays and even nasal irrigations. I would say the reason that I finally decided to seek treatment was just the feeling of embarrassment when I was going out to dinner with friends or in a social setting, or even when at my job taking care of patients, always having to discreetly try to find a Kleenex box to wipe my nose. All that finally pushed me to finally get treatment. So leading up to my neuromark procedure, I have seen the procedure done multiple times in the office. So I knew how quick and easy it was. But when it was my turn, I, of course, was a little nervous and hesitant about having it done. But my doctor was able to walk me through, again, the steps that were going to be done. And I knew I had a great team at the office to take care of me. My doctor told me that I was going to be able to go home same day, really pain-free recovery, and that I would be able to get back to my lifestyle right away. The first symptoms that I noticed to improve were the reduction of my runny nose while I was eating, which was a huge win for me because that was a very annoying symptom to have. The neuromark procedure has definitely improved my life in many ways. I feel like I have more confidence. I feel like I have more energy even. I'm not married to a Kleenex box, looking for it all the time. So I definitely feel lighter and just overall much happier. I absolutely feel like Neuromark was the right choice for me. I'm so happy I had this done, and I hope more patients out there know that there are treatment options that are easy, and I hope that more people feel like they can talk to their doctors about seeking treatment.